and some others talked about. I'm Brett Hendel-Patterson. I work at Health Partners at Regions in Palliative Care and Internal Medicine, and at the U and Global Health in the Department of Medicine. In some ways, to me, part of the elephant in the room is burnout too. I mean, I don't know. I mean, I don't know that we need to do a show of hands, but my guess is that we're looking at a minority of full-time clinicians in this room. Many, if not most, are probably practicing education, administration, leadership stuff as part of our jobs. And I think we've talked about how having a something that's happening beyond patient care is energizing, is something that's reducing burnout. And I don't know how much as educators, I mean, we're recognizing the importance of resiliency, but how much we're touching on burnout for our colleagues, burnout for the students that are working with us. And I think more and more when we talk about the me generation, I think the model is going to be to practice probably less than a 1.0 FTE. So not only do we have to train more numbers of students, we have to, train 0.2 more because more people are working 0.8 or something like that. And it's something that I just find very overwhelming to deal with, very overwhelming to think about. I'm biased, working in global health, about that being something that I think is something that can help improve resiliency. I mean, we talk about trying to connect people, communicate well, communicating, we all are shaped by those mentors of ours who conveyed passion, passion in caring for patients, close patient connections. I remember working with you in the ER, several years ago. Yeah.
Many.
Yeah. And so I think I loved all the comments about connecting, all the important comments from Mark, other folks from the U, St. Kate's. I'm sorry, I'm terrible with names, and just the importance of connecting. But I think how we connect around some of these issues of both training and keeping people who are out, because people need to be practice ready, but we also need to connect, someone who's not going to be the person that's going to be interfacing, mentoring, medical students, nursing students, PT, PA, and P students, how we connect those people with still being connected. I'm not phrasing this very well, but how you work to keep everyone connected and continuing to play well together. So you have to be practice ready, but you also have to be life ready. I mean, ready for your life in practice. Otherwise, we're going to just end up chasing our tails.
Well, so it's very interesting. So we're having our own existential sort of discussions within our Office of Health Profession. What is our role? I actually think that strategic design can help connectedness. And so if resilience is 4 things, clear values, the ability to connect, remain, the ability to bend, and some kind of reflective practice, are those practice-ready competencies. I think Cheryl was talking about that. The other one is this strong issue, this whole issue, what rang to me, is this the vulnerability of losing identity. We're trained in academic centers, and where what is valued is individual exceptionalism. To go from assistant, associate to full professor is individual exceptionalism and a regional and national reputation or something like that. So the whole infrastructure of training is, yes, trained for teaming by faculty that are by a design system about individual exceptionalism. So how do we set this up that it's actually okay not to focus on individual exceptionalism? As a matter of fact, it's even better to be vulnerable and to actually move away from professional identity and focus on patient care, moving away of a transactionary and measuring the transactions, but measuring actually teaming behavior. The study I would love to do is the Moneyball study. Who are the people that are, when they are on the team, everyone else works just a little bit better in the patient? It's actually, those are the people I would want to hire and everything like that. But I think we can do that. We can have some early wins. My last sort of babble, and it's 9 o'clock and people feel free to this, I just find it unusual that we mandate everyone that works in a hospital to do this ATLS or ACLS 2-day mandated course. I would like to have ARLS, a mandated 2-day course on acute resilience life support. Of having some didactic, some skill-based. That is so much more than a 2-day mandated course and everything. And I think we can do that together with that. The last thing, and Penny, I'll get to you, is if we're going to do a platform, which we do, the other thing that we've started toying with is actually incubators. So tech world does a lot of the business world, is that we're happy if there's an interest to kind of support a way for groups of 20 or 30 people to look at certain aspects of that. And again, won't ask for a show of hands, and some of the evaluation of this conference will ask if you're interested in some of those things.